All right, so now we're going to shift to one of my favorite and fun parts of the forum. This is our very fast-paced oral medley presentation. So of the many research abstracts that we received, an internal OSHA committee selected 15 to showcase in this session. You'll see 14 here on the list because the first one that's printed in your program, Dr. Lisbeth Baruta was not able to come. So we're going to start with Dr. Berry. And I hope that this session really gives you a sense of the breadth of the research going on in integrative medicine in our community. And it will entice you to go see all the posters during lunchtime. So each presenter will have precisely 1 minute to introduce themselves and summarize their poster. And this is all automatically set in PowerPoint, so I have nothing to do with it. It's just going to go on its own. It's going to keep us moving. So I ask that the audience just hold your applause until everybody has gone. And for the presenters, once you do your minute, you'll just sort of line up in the front here. We'll have a picture at the end. All right. So, whoop. All right, so here we go. Oops. Go back one. Okay. Terrific.
When do we start now? Good morning, everyone. My name is Michael Berry. So training in self-compassion, or the skill of being kind towards oneself in moments of suffering, shows promise for reducing disability and chronic low back pain. In particular, such training may improve the self-critical attitudes which often accompany this disorder, but the neurobiological bases of these improvements have not previously been explored. So to address this gap, my research group examined brain activity during self-criticism and self-reassurance before and after a brief 2-week self-compassion training, which was tailored towards chronic pain. So while undergoing fMRI scanning, patients were asked to imagine themselves in emotionally negative situations through either a self-critical, self-reassuring, or neutral lens. Following training, we observed changes to brain activity only during self-criticism, and these increases were associated with increases to activity in right dorsolateral prefrontal cortex, suggesting that brief self-compassion trainings for chronic pain may actually preferentially target self-criticism and its substrates in emotion regulatory brain regions. Thank you.
And one more. All right, so caregiving for veterans and military service member is stressful. So we delivered in this study a mind-body program by podcast to 34 female military caregivers from all over the nation, as you can see on the map. The program was adapted from the Benson Henry Institute's Smart 3RP program and included elements of psychoeducation, relaxation response practices, and appreciation practices. The program was composed of 12 to 15 minutes podcasts that were delivered daily for 28 days. And at endpoints, what we found was that participants exhibited medium to large decreases in perceived stress, as you can see on this graph, and also in anxiety and depressive symptoms. So now we hope at some point to be able to conduct a randomized controlled trial to confirm that.
Hi guys, my name is Sal D'Amico. I'm a project coordinator at Boston Medical Center. I work with So integrated medical group visits, IMGVs, are 9 weekly 2.5-hour sessions that include didactic materials on topics relevant to participants with chronic pain and depression. So an RCT was conducted at 2 community health centers and 1 outpatient clinic. So this slide reports on the secondary analysis of adoption of stress management techniques, SMTs, by participants. So SMTs were categorized as adaptive, such as exercise, meditation, social connection. So non-adaptive SMTs were defined as alcohol use, smoking, and illicit drug use. So the intervention participants had increased the average number of adaptive SMTs compared with control group at week 9. And for individual adaptive SMTs, there was a statistically significant increase for exercise and meditation. However, there was no significant difference for non-adaptive SMTs. So in conclusion, the IMGV is a feasible intervention that, to increase participants' SMTs.
Hello. In a prior study, we demonstrated that patients with gastroesophageal reflux who were randomized to an integrative medicine consultation had significantly greater improvements in their symptoms compared to patients who received a standard primary care visit, regardless of the treatment received. In this study, we conducted a sub-study to determine the relationship between physician and patient behaviors in the visit and response to treatment. We analyzed 2-minute segments from the beginning, middle, and ends of study visit videos and rated them for a variety of different global impressions, such as how engaged, friendly, or relaxed the patient and physician were on a 1 to 9 scale, as well as the number or length of time that different nonverbal behaviors were engaged in, such as smiling, nodding, or gazing. We found that in integrative visits, the physician was more engaged, friendly, and relaxed, and smiled more compared to standard visits. And interestingly, the combination of both physician and patient smiling at the end of visits was significantly associated with GERD symptom improvement. Thank you.
Hello. We integrated mindfulness and compassion training into primary care and mental health treatment to help primary care patients with making health-related behavior changes. In a comparative effectiveness RCT spanning 24 weeks, all patients created an action plan at week 7. We compared 8-week mindfulness training for primary care with a low-dose comparator, which represented standard of care with a mindfulness intro, had attention-matched research staff time with biweekly engagement phone calls. Compared with the LDC, participants randomized to MTPC initiated action plans more frequently with adjusted odds of 2.28. They also had improved in emotion regulation and interoceptive awareness with moderate to high effect sizes. Over 140 providers referred over 465 patients. Enrolled participants were 23% non-white, 38% on subsidized insurance, 30% earned less than $20K per year. Recently accepted for publication. Come see our poster number 40. Thanks to my team, CHA, the NIH, our patients, providers, and you.
Hello everyone, my name is Yongju Kim. Post-traumatic stress disorder, PTSD, is prevalent even among general population and has been associated with elevated risk of cardiometabolic dysregulation and multiple chronic disease. To understand the potentially modifiable behavioral pathway, we examined whether PTSD actually alters the behavior of dietary intake among more than 50,000 women in the United States. Our longitudinal analysis with the linear mixed effects spline model showed that compared with the healthy women, those who developed PTSD during the follow-up tended to have more unfavorable, unhealthful trajectory of dietary change measured by alternative health index and total flavonoid intake after the PTSD onset. Our findings suggest that effective behavioral modification strategies may need to be incorporated into the clinical and public health practices for individuals living with PTSD. Thank you.
We thank the Ocean Institute for this opportunity. The aim of this study was to compare and investigate the modulation effect of Tai Chi Baduan and second on patients with knee OA. We found that all exercise can decrease pain symptoms and increase PD-1 syndrome level and immune response marker. We also found that all exercises can decrease functional connectivity between DLPFC, a key region of attention control, with the supplementary motor area. The connectivity change can correlate with the corresponding pain and PD-1 level. Finally, we found all exercises can increase gray matter volume in the SMA. There are DLPFC connectivity differences among 3 exercise groups. Finally, our results suggest that different exercises may share common and unique pathways for pain modulation. Thank you. Thanks for your attention.
Hi everyone, Yan Ma, first year T32 fellow. Our study evaluated long and short-term Tai Chi training effect on lower limb muscle co-contraction during walking under normal and dual task conditions. Specifically, we used surface EMG to measure muscle activity of the anterior tibialis and gastrocnemius. For long-term effect, compared to age-gender matched Tai Chi naive adults, the Tai Chi expert has significantly lower muscle co-contraction under both single and dual task conditions. Longitudinally, after 6 months, we found a trend toward lower co-contraction in Tai Chi group compared to usual care control group. Although the difference was not significant, we believe that improved neuromuscular coordination of the lower limbs may contribute to Tai Chi's positive effect on gait and balance. If you are interested, please come to poster 23 for more details. Thank you.
Hi, everyone. The title of my research is Effect of Duration and Amplitude on Passive Stretching in a Rat Carrageenan-Induced Inflammation Model, exploring the dose effect of stretching. Our goal was to compare the effect of stretching duration and amplitude in a passive stretching intervention. We hypothesized that passive stretching would have a dose-dependent effect in neutrophil count. In this model, rats were injected with carrageenan 1% and then passively stretched twice a day for 48 hours. And then we found that it reduced the number of neutrophil counts when rats were stretched for 10 minutes with an amplitude of 25%, or when they were stretched by 5 minutes with an amplitude of 35%. Our results suggest that stretching could be used as a complementary intervention for inflammation of the connective tissue. However, we need more study to explore the dose effect in a chronic stage or setting, as well as the effect on pro-inflammatory mediators. Thank you.
Hello, my name is Camilla Osipiuk, and my poster is about the relationship between posture and mood in breast cancer survivors with persistent post-surgical pain. Breast cancer survivors often suffer both physical and emotional side effects, including persistent pain, which has been linked to anxiety and depression. Some studies suggest there might be a relationship between physical posture and mood. And while mind-body therapies may target the intersection between physical and emotional symptoms, it's not known whether their psychological benefits are related to physical posture. As part of an observational study of Qigong for survivors with persistent pain, we evaluated the relationship between posture and depression. We used a 3D motion capture system to measure posture and a self-report scale to measure mood. Results suggest improvement in depression and a trend toward more upright posture post-intervention. We also saw a positive correlation between changes in posture and changes in depression score. Come to poster 28 to learn more.
Hi, we conducted a pilot study to develop an intervention for parents of children with learning and attentional disabilities such as dyslexia and ADHD. It's a growing population that gets little attention, with 1 in 5 school children being affected. We adapted the existing Benson Henry Institute's resiliency program, doing in-depth qualitative research to identify and adapt the exercises to the needs of those parents, including difficulties getting a diagnosis, ongoing advocacy with IEPs, social isolation, and marital strain. We were proud that although only 50 people were recruited, we saw very significant effects post-treatment, comparing the intervention group to a waitlist control. We were also particularly excited that looking in the intervention group 3 months post-treatment, that these effects held. We are hoping to develop partnerships nationwide and conduct an implementation study. We leveraged the MGH telehealth video system. It kind of looks like a Brady Bunch when you're doing group treatments via telehealth, and so that allows us to continue our search nationally. Thank you.
Hi, I'm Travis Peterson. So selenium is an essential micronutrient that comes from the diet and is primarily used in the creation of selenoproteins, which are a small family of antioxidant proteins. Selenium recycling is very important for the creation and maintenance of selenoprotein levels when under selenium deficient conditions. When we have selenium deficient conditions or when selenoproteins are not working, we end up with various myopathies in both animals and humans. So in our study, we used selenium-deficient conditions and loss of selenium recycling in a mouse model to see what the effects were, and we saw that slow twitch muscle was more impacted than fast twitch muscle. And this is important for further studying various myopathies in humans and understanding selenium's role in healthy muscle activity.
ApoE4 is a major genetic risk factor of Alzheimer's disease. However, 1/3 of dementia cases can be attributed to modifiable risk factors that we can impact in clinical care despite the gene expression. We embedded a health coach called a Brain Health Champion, who is specifically trained in evidence-based non-pharmacological interventions into routine care with patients diagnosed with cognitive decline. Through personalized goal settings and weekly phone calls, the BHC improved patient adherence to brain healthy recommendations over a 6-month intervention. As compared to the standard of care control group, there were statistically significant and clinically meaningful changes in self-reported physical activity, diet, cognitive activity, and quality of life. This is a low-cost, scalable intervention that can be personalized to each patient's individual risk profile. In the next phase of the study, we hope to investigate a larger patient population, including those at risk for cognitive decline, and include objective measures to track adherence through wearable devices and mobile health platforms. Thank you.
Hello, this is Güneş. How many of you check your email or social media to avoid stressful thoughts? This is called cognitive avoidance and is a gateway to stress and anxiety. Meditation, on the other hand, gives an opportunity to stop doing this and embrace those thoughts in a non-reactive way. In this study, we hypothesized that this non-reactivity during meditation provides a basis for extinction learning and adaptive regulation of one's emotions. To test this, we randomized participants into mindfulness or stress management training and scanned their brains using a 2-day extinction learning paradigm. In line with our hypotheses, mindfulness improved extinction learning through changes in hippocampal networks. Now, we know that the ability to remember that a stimulus is no longer threatening is a key mechanism through which mindfulness reduces stress. And this is why it is a better option than checking your Twitter account when you are stressed.
All right, that was wonderful. Thank you so much. Let's give everybody one last, another applause.